Well, welcome back. Today, what we're going to talk a little bit about is diving. I'm not sure how many of you guys scuba dive or anything like that. You probably know a lot about what we're going to be talking about. If you don't dive, hopefully this little presentation won't stop you from doing that. You should have a good time with it. So basically, one thing you want to remember, we talked about flying. We looked at all the different things that can happen. Remember, as you go up in altitude, the pressure decreases. We see things expanding. Gas expands in the stomach, the ears, the sinuses, whatever. When you're diving, you're going the opposite way. So instead of expanding, everything's now going to be compressed at that particular point, okay? For the most part, if you look, diving accidents have decreased. Women do a little bit better than males do. You can drown in almost any environment as long as there's enough liquid or even solid material that gets in there and prevents you from breathing very well. And then when we talk about diving, we're going to talk a little bit about the breath hold diving or free diving, and then we're going to talk a little bit about scuba diving also, because there's different things that can happen with both of these. Now, if you have cardiac issues, if you have breathing problems, if you tell the people that you're trying to get them to teach you how to dive, a lot of times they won't do that simply because if you run into problems underwater, they're not going to be able to rescue you at that particular point. So one thing you want to remember when you go diving is that you have 760 millimeters of mercury, 1 atmosphere, when you're at the top of the water or standing on land. As you go into the water, and if you go down 33 feet or 10 meters, you're adding another atmosphere on top of it. So really, technically, at 33 feet or 10 meters, you have 2 atmospheres on you, the one that you started off with before you got into the water, plus the one now that you have in the water. And so if you look at Dalton's law, if you use that one, 760 times 2, 1520 times 0.21, the partial pressure of oxygen in your body is about 319 millimeters of mercury. And this is due because of the compression of the water and the oxygen that's in your body at that point. So there's some causes of diving injuries. The injuries can come from the environmental pressure changes, especially if you're not used to them. Breathing compressed air is another one. When you dive, the gas in the tank, the pressure doesn't change. The pressure changes when it gets into the body, okay? And when we're talking about the different gases, we're going to talk about oxygen, nitrogen, carbon dioxide, carbon monoxide, whatever else happens to be around at that particular point. So there's, again, Boyle's law, okay? Remember your pressure volume vary inversely, okay? Dalton's, you're going to have an increase in your nitrogen in addition to an increase in your oxygen. And then Henry comes in and he throws in a little bit more for you. So some of the diving injuries that we look at, nitrogen narcosis, air emboli, probably the worst diving injury you can have is an air gas emboli. Unfortunately, a lot of people end up dying from those. The squeeze is another one, carbon monoxide poisoning, oxygen poisoning, anoxia, carbon dioxide, decompression illness, and then cold weather. And drowning, we don't think about drowning as being a diving injury, but it is if you don't make it out. As you can see, this person is very interested in the fish that he's watching. Oops, all gone. So the first injury we're going to talk about is nitrogen narcosis. This is also known, as you can see, rupture the deep or the Martini effect. And this is because the nitrogen is leaving the lungs and it's actually going into the body, and it has a direct toxic effect on nerve conduction. This happens about 30 meters or so under the water, and basically the diver gets very sleepy, much more relaxed. They feel very comfortable at that particular point. And unfortunately, what happens with that, sometimes they act kind of strange, okay? We had a person who used to work here at PMI, and she went off to do diving because she really, really enjoyed it. And she was going to get a boat and take people on diving trips and things like that. She found out that her level for nitrogen narcosis was like 100 feet down. And how she found that out is she was diving with a partner, and you always want to dive with a partner. And I'll tell you a funny story here. Actually, not funny, but I'll tell you a story that's interesting. We'll put it that way. But anyway, she was down at the down, and she went beyond the 100 feet. And when she got down that low, she was looking at the fish that were going by, and there were some sharks that were going by. And what she wanted to do, she wanted to go out and pet the sharks and things like that. And her diving partner's like, "Oh, I don't think we want to do this." And he finally got her to come back up above the 100 feet. And when she did, she snapped out of it and she realized what she was doing. So she now knows where her level is at that point. As I mentioned, you always want to dive with a partner. It was really kind of sad, but there's this little newspaper clipping one time that talked about some guy who just got hired at a golf course, and one of the things he had to do at night was to go into the water traps and pull out the golf balls. And unfortunately, they found him dead because he drowned in one of the water traps, and he had nobody with him, so he didn't quite do what he needed to do. Shallow water blackout. This was kind of an interesting one because it sounds like it has just a very, mundane type name, but it's a really, really, really bad syndrome that happens to breath hold divers. And basically, it's two reasons that it happens. One is hypoxemia, and the other is the lack of drive to breathe. What happens with this is that people have a tendency to hyperventilate because they want to get the most oxygen in their lungs. And you guys remember at room air, you can hyperventilate yourself up to about 120, maybe a little bit more, but normally 120 millimeters of mercury of oxygen, and drop that CO2 down to about 20 millimeters of mercury of CO2. And if you remember, in order to be able to breathe, you got to get that CO2 to go up. And so how do you do that? Is you stop breathing. Well, what happens with these folks, they go ahead and they dive. Because the oxygen content is higher in their blood, now they can stay down, and they're using the oxygen, they feel fine, and everything is working out really well for them. However, as they start to come up, now their oxygen levels are going down, but their CO2 levels are still not coming up at that particular point. And so as they start to approach the surface, they now become hypoxemic. And because of that, they pass out, okay? And the problem is that the CO2 has still not risen to the point where that they're going to be able to take a breath. As a result of that, they will fall back into the water or even stay below the surface of the water, at which point in time they'll go ahead and drown. And unfortunately, a large number of those end up dying as a result of it. So lung barrel trauma or expansion injuries, basically what happens with this, the diver will hold his breath as they're coming up. The pressure in the lungs is equal to the surrounding water pressure at that point. And unfortunately, as they come up, the lungs are going to expand because the pressure in the water is getting less and less. And you need to remember your lungs can only expand so much. And as a result of that, what happens is you're going to start to tear up the lung tissue. And as you do, air is going to enter tissue, or it's going to enter into the bloodstream at that particular point, which is not too healthy. Then air also can become trapped in part of the lung due to an obstruction. You could have a cold, some mucus, something else going on at that particular point. And so as you come up, the same thing is going to happen because now that air is expanding, the lung's not over expanding at that particular point in time. And so you're going to start to tear up the lung tissue at that particular point too. And so when you have the rupture of the alveoli and the capillaries, now we're going to start mixing blood and air in the lungs, and you're going to start coughing up some blood, some pink fluid, and end up with something called pulmonary edema. So what else can we end up with this? Arterial gas emboli. Like I said, that's your AGEs, or the worst diving injury that's out there. There's a pneumothorax to throw into the mix, subcutaneous emphysema, mediastinal emphysema, and we can also see a thoracic squeeze because of the lungs expanding at that particular point. Decompression illness is another injury that we see. There's either 2 or 3 types of decompression illness, depending on who you talk with. If you see 3 types, it's normally the air gas emboli that they'll add to this. This is also known as the bends. This is something that Boyle saw when he was watching the caisson workers building the bridges in New York. These guys were down under the water, and they were down there for hours. And when they came back up, they were bent over, and they were bent over because of the nitrogen that was sitting on their spinal cord. So how do you get this? It can be from breathing air for prolonged periods at great depths. This nitrogen is leaving the lungs again. It's going to get absorbed into the blood and tissue. And fortunately, as you start to come up, the nitrogen is going to get bigger and it's going to cause a blockage. And as you can see on here, it can act like an MI, a CVA, or a pulmonary emboli at that particular point. Another reason you can get this is diving too quickly between dives, or staying down too long and misjudging what you have. So divers who dive have dive tables, and it tells them, how long they can stay down. And then also, these dive tables are also used in case you have to go to the hyperbaric chamber. Now, one thing that you have to remember with this too is that the nitrogen is going to be dissolved and remain in your body for at least 12 hours after each dive. If you're planning on a flight the next day after you dive, it's not going to work for you, because you may end up in the chamber. If you end up in the chamber, you can't fly for 24 hours at least, because what happens is as you go up in altitude, the pressure drops, the nitrogen goes back, and now you have a problem because you're not repeating what happened to you with your diving injury. So the first type is your musculoskeletal form. This one starts with mild pains, and it can start to resolve within about 10 minutes of your onset, okay? Most of the pain that you see are in the joints of the arms, the legs, the back, or in your muscles. It's hard to pinpoint. It's there, and you know it's there, but where is it? It's kind of hard to do anything about, indicate where it is, okay? And basically it can go from very mild to very severe over time. So you have to watch that. As you can see too, the bends or pain occur in about 70 to 85% of people who dive. And the most common site for this is the shoulder. And if you think about the shoulder and the heart, the location of the heart and the location of the lungs, that makes a lot of sense. Type 2, this is a little bit worse than type 1. As you can see, you have pulmonary symptoms. You can go into hypovolemic shock. It does involve the nervous system. The symptoms start either right away, all the way up to 36 hours, okay? The most common place where we see the problem is in the spinal cord at this particular point. It produces neurological symptoms that can go from mild all the way to paralysis and possible death, okay? You can also have some problems with your bowels, your renal system. In the brain, it can look like an emboli at that particular point in time. You can become confused, have a lot of headache, vertigo. You see that on effect because of the inner ear will do that for us. Tinnitus is another one, and then sometimes people have hearing loss. Some of the pulmonary involvement, this is your chokes. If you remember way back in therapeutics, we talked about too much pulmonary response to too much oxygen, and that was the chokes. What you have is that dry substernal chest pain and that dry cough that goes with it. And sometimes they have difficulty in breathing too. And unfortunately, like I said, you can go into shock and you can die from this too. And symptoms again, time of exposure, the depth of the dive, circulatory efficiency. This is part of the reason why if you have cardiac issues, they don't want to teach you how to do deep diving at that particular point in time, okay? Other things that we can see with this are seizures, and then you can also become paralyzed, and it can sometimes affect one side of the body. And so this is one of those injuries that you do have to go to the hyperbaric chamber. This is just a dive table, and you can see, you can go through and take a look at all the things going on. This dive table now, you can actually have like a little watch, and the dive table could be on the watch, and it can help you and tell you what's going on. And there's the air gas emboli. This is the leading cause of death among divers. The symptoms occur somewhere within minutes of surfacing. If you get it into the brain, because now you're talking about bubbles again, you can look like you have a stroke. You can also have confusion, paralysis, a sudden loss of consciousness, and if it's severe enough, it can lead to shock and death fairly quickly, okay? How does this occur? Well, as you're coming up, you're holding your breath. As you're holding your breath, the lungs are going to rupture again a little bit. The air escapes through the ruptures. They get into the pulmonary capillaries. They enter the heart through the pulmonary veins. And then, unfortunately, they go through the aorta. And that's how they end up in the body. There's a gentleman, and I can't remember his name, was Nick, and I'd have to look his last name, but he was diving, and one of the things they figured that killed him, he was a very young man, he was in his 30s, was because he probably died of an air gas emboli. He had been diving, trying to set a free hold dive record, and he went down, he came back up, and then he went right back down again. The next time he came up, he was dead within about 30 seconds of surfacing. So what happens then, there you see the bubbles become bigger bubbles, they block the artery. We still see the same thing we saw with type 2, confusion, dizziness, all of those different things. And the biggest thing is, though, how quickly this actually does onset. And you definitely have to go through the hyperbaric chamber. And what they do is they use that dive table to figure out how long you're going to have to be in the chamber. Let's see this. If you have to fly these folks to the chamber, one of the references says you can't go higher than 1,000 feet. Another reference said 2,000 feet, whatever it is. Lay them down because you want to keep the bubbles away from where they're where they're not supposed to be. Keep them out of their lungs at that particular point in their head. And what's interesting is they have found out that whales have similar injuries too. You would think the whale, because they live in the water and everything, but they have found very similar injuries in them as they did with the folks who have air gas emboli. Lung squeeze is really kind of an interesting one. The first time I saw this, I went, I don't have saying, can you get the lung volume less than residual volume? Because if you remember, residual volume is a very small portion of your lungs, but because you're going down at great depths, you can actually compress the lungs to where the volume is less than residual volume. And we see this in your breath hold divers also at this particular point. So how do you prevent this? About halfway down, you got to take a breath, okay? We also can see what's this in scuba divers who completely exhaled. You got to be careful with them because then there's nothing in your lungs to help keep them open. So you compress the lung below your residual volume, your pulmonary capillaries swell, you have leakage into the lungs, and then unfortunately it's going to enter the alveoli and interfere with gas exchange. And unfortunately, remember, it's very hard for air to penetrate water and get into your circulation. And so, unfortunately, you could have some very unfortunate outcomes from this too. Middle ear squeeze is kind of a cool one. Remember, when you fly, you've got to clear your ears and keep them popped. When you come down, the same thing. When you go diving, the same thing. You have to be able to equalize the pressure as you're going down at that particular point. And as you go down, if you don't do it, you can see that you get these sharp pains, and then you can end up with barrel otitis with it too. Once you come back up, you get to go to see your friendly doctor, get some antibiotics, some decongestants, and some steroids, and take care of your ears at that particular point. And then the friendly eardrum rupture is another one, okay? This one, you also have the sharp pain. However, the cold water, when it fills the ear, actually helps relieve that pain. Unfortunately, I'm not quite sure you want water in your brain cavity, so you do have to be careful with that. But you'll have vertigo, blood, return to the surface rather slow, so you don't run into another issue, and then you're going to need to go ahead and seek medical attention at that point. And then reverse squeeze is another one. This one basically happens as you ascend. At that point, the eustachian tube can be blocked during the dive. Remember, if you have a cold, you don't want to be flying. If you have a cold and sinus congestion, you also don't want to be diving, okay? And so you block the eustachian tube. It's going to force your eardrums outward, and sometimes too what happens is your diver will still try to use the Valsalva movement, but unfortunately when he does, it's going to cause the squeeze on the ears at that point. And then you can also end up with a round window rupture. This is from your lengthy and forceful Valsalva. Things that you can do with this is you're going to have reduced hearing, ringing or tinnitus in the ears, some vertigo. And basically what you're doing is you're putting a lot of pressure on that little round window in the ear. And it tells you what happens with this one too. More pressure added to pressure, and then you rupture the eardrum. This actually is a very serious medical problem. It can decrease your hearing or cause deafness. As you can see with this, you need bed rest, avoiding loud noises, and you can't dive or fly for several months because you're going to re-rupture it at that point. Swimmer's ear, you can get that from your friendly swimming pool. Basically, what happens is you change the pH of the ear canal from acid to alkaline. And so you start growing things in the ear that's not supposed to be growing in there. And so what you can basically do with this is go get some vinegar and pour it in there, and that'll change it back from alkaline to acid. Or you can go buy some of the commercial stuff that you can use that will do the same thing for you. Sinus squeeze. Diving with blocked sinuses, again, as we mentioned a couple of slides ago, don't fly with blocked sinuses, don't dive with blocked sinuses, okay? And this happens as you go down. So you get this pain in the sinuses, the same places that you're going to have the pain is when you're flying at that particular point. And what happens then as you ascend, you're going to have blood and fluid that ends into the nasal cavity. And if you're wearing a mask, that's where it's going to end up. Cold weather, working in, as you can see, less than 60 degrees Fahrenheit, you lose your efficiency and you lose your concentration and you become very tired. And wetsuits work, but wetsuits only work for a small amount of time. If you watch the TV, where the crab fishermen, they tell you that if you're not wearing a wetsuit, you got like 3 or 4 minutes to survive. And that's very true because that water is extremely cold. The wetsuit will help you a little bit longer than that, but not much longer, unfortunately, at that point. And unfortunately, sometimes that's what happens to you. Hypercapnia, remember, that's too much CO2. This happens because you're breathing very fast and shallow. And what you're going to do then is you're inhaling your exhaled air at that particular point. And so the CO2, you're rebreathing your CO2 is basically what it is. And so what do we see? Headaches, confusion, all the things that go with too much CO2 at that point. And it can also cause blackouts. And we see this mainly with people who are scuba divers or divers who are wearing full face masks because they're not able to get rid of the gas. Okay. Let's see here. And then O2 toxicity, we don't think too much about that, but that can happen too. Remember, central nervous system, pulmonary toxicity are the two types we can get. Central nervous system, trembling, nausea, the whole 9 yards that goes with that. And then the chokes again. And again, this is results of the exposure of the oxygen. It's that dry substernal chest pain, that dry cough that you have at that particular point. Carbon monoxide poisoning is kind of an interesting one because people will tell you it's really not a um, diving injury, but it is a diving injury when you think about it, because what's happening is remember, your carbon monoxide has a greater affinity for hemoglobin than oxygen does. And so if you're diving and you have carbon monoxide in your tanks, you're using the oxygen because you have enough oxygen and everything. The problem is, though, as you're coming up, the oxygen is leaving, and now the hemes are being filled with that carbon monoxide at that particular point. So how do you get carbon monoxide in your tanks? Well, if you fill them next to the exhaust of a truck that's poorly tuned, if you're sitting there smoking, it doesn't take too many cigarettes to increase your carbon monoxide levels and things like that. So what happens to you? There it is when you ascend, headache, confusion, all of those other things. This also, you can pass out, and then if you pass out, you can then suffer shallow water blackout and then drown, and unfortunately have a very short life. Then you have anoxia, which of course means not enough oxygen, or O2 toxicity at that particular point. How does this happen? Sometimes people don't pay attention to their tanks to make sure that they have enough oxygen in there. They're going to go out and dive, do whatever else that they're going to do, and they run out of oxygen at that particular point. Mostly happens with people who have the close breathing circuits because of the tanks that you're using. Okay. And at the bottom, watch out for fauna and flora. There's some beautiful sea snakes down there. They just love to see you. You also have the eels. You guys know too, the jellyfish. Steve Irwin died of a barb from a jellyfish. And there's also, mainly if you go around Australia right now, as far as I can remember, there's these little, like almost microscopic jellyfish that if you get them on your skin, cause extreme pain, and to the point where sometimes giving you pain medication doesn't do anything. There was a really cool story on TV once about this lady and this gentleman that had dove. She ended up with some of these little microscopic jellyfish. Her partner went to take her wetsuit off, help her get the wetsuit off, and he ended up having some jellyfish on him. And both of them were in the hospital for about 7 days, and they said it took about 5 days before the pain meds were enough to where they weren't suffering so much pain. So you need to know what's in the water when you're doing things like this. And then watch for any other creatures that are down there. Remember, there are a few sharks that live in water, and if they're a little on the hungry side, or you look like what is it, a walrus, or you look like something like that, sometimes you might become their dinner if they have a chance. And then again, the sea snakes, do watch out for those. They're pretty. So basically, how do you prevent all of these? Make sure that you take a good lesson and learn about them. Know your limitations, okay? No alcohol, strange mushrooms, frogs, any other drugs. Remember, people like to take the Rocky Mountain toads, and they like to freeze those, and then they get to lick whatever's the frosting on them, and that is a cool drug. Unfortunately, it causes some psychedelic problems too. Be fit. Don't go out partying the night before and become, dehydrated. If you have a lot of alcohol, that's going to happen. If you do have breathing, heart problems, or conscious problems with your ears or anything else, stay out of the water. If your air tastes bad, you probably got some carbon monoxide in it. Get away, and then don't get too hot or cold. Now, one of the things too, just to think about, we talked about anoxia and ototoxicity, different things along that line. When people are doing scuba diving, they're not using 21% oxygen. A lot of times they're using like a triox mixture that has different gases in it. And one of the times what they'll do is they'll sometimes just use 10% oxygen, and that helps to avoid some of these problems.